Hello friends, I am Costa, and today I am here to share a very interesting clinical case with you, which I believe is part of the clinical routine for many of you watching. Alan, implantologist, and for 19 years I work in implantology, prosthetics, and periodontics. For 8 years I have also started digital dentistry, which are guided surgeries, CAD/CAM prostheses, and everything else. So if you want to know more about our work, you can also follow us on social media. Here is my social media. And here we also have my WhatsApp, where you can get in touch if you wish. If you have any questions or want to talk about something, just write to us. Okay, let's go straight to our clinical case. I will show you the case of the patient Angela Cardoso here, and I will show you that this is a very common routine that appears in our office. The patient came in this manner at our office. I believe that many people who are watching this case will likely look at a case like this and think, oh, extract everything and place a protocol. Many people would do it that way. What are the classifications of the types of protocols today? The MISH classification includes PF1, PF2, and PF3. PF1 is essentially a fixed prosthesis, dentate, with the size of natural teeth. PF2 would be teeth in elongated sizes, but without gingival compensation. And the classic protocol, which is PF3, would be a prosthesis within the gingival. Teeth in natural sizes and an artificial compensation, with the patient's artificial gingiva compensating for the loss the patient had of gingiva or will lose in a reduction of the bone structure. So many people would think, wow, I regularized the bone structure and place a protocol. But what if we use a PF1 type prosthesis for the patient, working with the patient's natural teeth? In a situation like this, in this particular scenario, can you immediately proceed to perform a PF1 surgery? Of course you can, obviously. But is it ideal for us to go straight to surgeries for this type of procedure? Look at the issue of gingival inflammation that we have here with this patient. A site that is not yet perfectly ready to receive implants, requiring additional preparation and a conditioning process where you need to work with excellence in soft tissue manipulation, ensuring meticulous handling and careful consideration of every detail. So if you suddenly find yourself working in a situation like this, you can often experience considerable aesthetic losses that will be difficult to repair later. So what is the proper way for us to work with this patient? It is to achieve an environmental adjustment. So the patient presented with this temporary prosthesis that you can see here in this area. It was all inadequately adapted, patched up with resins and everything else that was available. So we necessarily need to work with what we call environmental adaptation in this patient if we want to achieve excellence in the result of a PF1 prosthesis. What would this adjustment of the environment be? We work with some type of provisionalization for this patient so that we can improve her health condition, allowing her to receive these implants. But you must be wondering, on the other side, you must be saying, gosh, but with a medium adjustment, making provisionals, I will have multiple expenses related to that. Why should I spend on a temporary prosthesis, since it's not my goal yet? I will have to make another temporary one later when I place the implants. What types of temporary prostheses can you make nowadays in a case like this? You can make temporary restorations with bisacrylic resin. You can make milled temporaries in the lab, do some milling. But then we are talking, folks, about milled temporaries with quite high costs, considering that at this stage of the patient, you will be doing a medium conditioning for this patient. But have you ever thought that today you can use and work with printed provisionals, which are incredibly versatile and customizable? Here, I will show you in detail how we used BioCrown resin from MakerTech for the development of this case, its evolution over time and under various conditions, and its adaptation. This provides you with a super aesthetic alternative, one that offers both resistance and aesthetics, as well as material economy, ensuring durability and a high quality finish, making it an excellent choice for a wide range of applications. And using materials like this to reduce costs in treating the patient. So for instance, the patient presented in this way, and indeed, we needed to make an adjustment for this patient. This adjustment we made, we specifically requested the prosthetics laboratory to indeed make this set of temporary prostheses for us, which would be a fixed denture. We were going to make a very supportive denture. In this image you are seeing here, no type of implant has been done yet. A provisionalization was made for this patient based on the root situation that the patient still had, the remaining teeth that the patient still had. Look at the absolute beauty we have here of a provisional printed with this incredibly fine resin from MakerTech that you can see right over here in this area, right here in the corner, okay? And with the use of this resin, BioCrown, you achieved an aesthetic result as you can see here. But it also provided a result of resistance so that you can leave this temporary in the patient safely. So you see, in essence, this is the first set of provisional arrangements you are basically making for the individual patient to essentially adjust the patient's condition. And often, in many cases, we need to create additional sets of provisionals to improve the aesthetic aspect before proceeding directly to the surgical part for the patient. So look how interesting. Here in this situation at the top, we have where we see the patient's temporary prosthesis in the current situation without the temporary prosthesis, and here immediately on the same day, the placement of the patient. So the patient did the scanning with us. In this region, the prosthetist made the provisionals more or less following this type of provisional adaptation, shape, distribution of the teeth and everything else, so that we could have a provisional to do a rebase, like the one you are seeing here, a printed provisional right at the time of removal from those old temporary prostheses that the patient had in that old fixed bridge that the patient had, but which was made a long time ago and was being patched up and everything else. And when we proceed and place a provisional restoration on the patient here in the initial situation in this region, here we already have a substantial and significant improvement in the tissues around the teeth 2 weeks later, showing a visible and noticeable enhancement. And many people, in fact, would even get into a certain conversation actually saying, gosh, maybe I can indeed even save some teeth in this patient. Perhaps, actually, indeed. And even placing some partial implants instead of doing full implants on this patient. Because look at how this adjustment works, folks. It allows for a significant improvement in the tissue. And as you can see here, I already have healthy tissue. And look at the gingival irritation I had in this area. And then things start to progress. You have the provisional set, you can move on to other provisional sets to improve the shape. And you achieve a significant improvement in the patient's gingival condition. Here we started to better condition the tissue in that region. And we were conditioning and working with these temporaries, which resulted in a significantly much better situation. So here in this image, as you can clearly see, it's a comparison of the initial phase of the patient and then 5 weeks later, showing how the patient initially presented in the evolution of the gingiva. So look at this image that you can see here, this situation and then this one here. See how there was an improvement in the tissue? We already have much more confidence when doing this type of work. I haven't even gotten to the surgical part yet. I haven't even planned the surgical part yet. I'm making an adjustment in this patient's environment so he can receive these implants and this new prosthesis in a much more favorable tissue condition. So here you can see the initial situation of the patient, then the situation right after the first set of provisionals. And from that set of provisionals to now, we haven't changed them yet. It's been 2 weeks, right? We didn't change the provisional set. It's the same provisional here. It's the same here. But look how we have indeed visibly a remarkably substantial improvement in the tissues around the teeth, very significantly, so that we can work at the extreme performance we need in PF1 cases for my patients as well. And in this comparison where we have here, where we have 3 weeks later and then 5 weeks later, we can see clearly observable changes in this specific time frame when we analyze the data. So see how the tissue has already been improving, and in this situation here, we already have a much better response. Because it's no use, folks, to rush through the provisionalization process for the patient in this particular and specific scenario, in any case, at all. You have to give a bit of time for your tissue to respond calmly. And all of this is done with printed resin in a highly efficient manner with a very acceptable aesthetic for the patient. And you also have, in this case, as you can clearly see right here in this image, a second set of provisionals, which is quite evident. So there it is, the first 5 weeks later. Then I let the tissue breathe, I let the tissue improve. As you can see here, these are the temporaries. So we have the first set and the second set of temporaries. So here I wasn't yet concerned with the aesthetics of these temporaries. And now, in the second one, I already wanted to improve a few things. I wanted to improve the shape a bit, and I wanted to improve the sizes of the teeth a bit. And I wanted to provide an arrangement that was aesthetically pleasing, because at that first moment, I wasn't so concerned with that issue. I was really more concerned about getting these tissues very healthy again, so that I could progress with my case. And before we got to the patient's surgery, we made this new provisionalization. Look how beautiful, the second set of provisionals. Using the same BioCrown resin, we made the impression with all the improvements in the delicacy of the tooth size. The patient was short, a small patient, and this type of tooth shape you see here in this region didn't suit her. She matched much better with this shape. That region of the papilla, the cervical area, which we are seeing here on this patient's lateral side, and then this space being intentionally left, hoping that the gum might descend a little more to create an improvement in the zenith, in the profile there on the lateral side. So when we work with these temporaries, we feel much more comfortable making several sets because you become very concerned about the cost issue. We are all indeed very, very, very concerned about the cost issue. Wow, I will have to make a temporary set, then I will have to make another one, and maybe later still make another one. But I haven't even done the surgery on the patient yet. I haven't even made the provisional implants. Yes, folks, it's necessary because of this conditioning issue, Gildeval. Imagine you arrive at the patient's surgery and you're there at the patient's surgery or already with the provisionals on the implants. That's when things start to get expensive if you keep doing trial and error in your patient's planning and the provisionals on the implant. So you are studying the shape in a meticulous manner while calmly allowing the tissue to breathe. And you are achieving agility and producing these temporaries at a much lower cost and much faster, and precisely with great care. Imagine if this patient ends up breaking these temporary prostheses that you placed on the patient. What will happen? You just call your lab and say, hey, please print another set. Without the improvements yet, I'm saying, a print of a new set of provisionals for you to make an adjustment. Because that's the great benefit, folks, of working with digital. Unlike the old prosthetic devices, the way we used to work, which many people still do, where you have to do tooth assembly, waxing, and all those procedures to get it done, and this process is more expensive, here we feel very comfortable because with these improvements we are making, we have a digital file of the patient, and we implement these improvements for the patient, having the confidence of a lower cost. We can definitely print as many sets as needed, having confidence in the aesthetic aspect and the durability of this provisional. So here, these images show the entire progression of the case for you. Look how interesting this is, 4 weeks later, right? Then here, 5 weeks later, in an occlusal view, you can see the improvement of the tissue. So look here, the patient is already in a quite favorable aesthetic situation, as you can see in this image. She is in a very good aesthetic situation as the patient has regained her self-esteem after arriving with those teeth in that condition, coming loose and breaking. So right here, even before you get to the surgery, you can already give this patient a significant boost in self-esteem because she already feels more confident in smiling, more confident in chewing, in eating. So in addition to all these benefits of tissue management that you are doing for your patient, you also have all these aesthetic benefits for this patient. In this part, you saw all the manipulation of the patient's tissue and the entire phase of medium adjustment. Now we will enter the surgical phase of the patient. So if you want to continue following this case, stay here on YouTube and you will see us explaining the surgical aspect of this patient and how the case was managed. A big hug.